at Colorado State. And we're welcoming you to the another version of Dr. Ram in a live Google Hangout. Today's session is going to be on foaling mares and care of the newborn foal. And I'm here with Dr. Ryan Ferris, another veterinarian. And Dr. Ferris, why don't you introduce yourself?
Hi, I'm Dr. Ryan Ferris. I'm one of the veterinarians here on staff at the Equine Reproduction Lab. I've been on staff here for about the last 4 years.
So we're going to go ahead and get started with the program, and we'll get the emails, the PowerPoint called up. And as a reminder, you can submit questions for this Google Hangout session at the in the section below, the comment section below, and you can also email us by the CVMBS social media at colostate.edu or using paging Dr. Ram on Facebook or Twitter. So we're going to start the PowerPoint presentation now on foaling and foal care. So we're going to start off by talking about the pregnant mare and the newborn foal. And the concepts for a successful foaling season is that everybody needs to be prepared for that foaling season, which would be preparing the mare for giving birth, how to predict when a mare is getting close to foaling, what to do in case of a difficult birth, and then what to do to care for the newborn foal. And we would advise everybody to have a foaling kit on hand. Most mares foal out at night, and it's been estimated that over 90% of mares foal out somewhere between 9 p.m. and 8 in the morning. And in the graph on the right, you can see this arrow is at midnight, and you can see the vast majority of mares, this represents over 1,000 mares giving birth, the vast majority of mares foal out in the middle of the night. In the signs that one may look for impending foaling, maybe the most common one would be waxing of the teat ends. And in the photograph on the right, you can see this waxy material, which is really colostrum that's dried up as it's been slowly secreted out of the teat ends. And on exposure to air, it's dried. And it looks a little bit like candle wax. The old saying is typically that once a mare waxes up, she usually foals out in a very short period of time. When we look back at data from many hundreds of foalings, about 70% of mares actually wax up, which means 30% don't actually form this candle wax looking secretion of colostrum. If they do, the majority of mares do foal out within 72 hours. The majority of them foal out within 24 hours. Some mares will actually drip milk or run colostrum prior to foaling. We don't want that to happen, and a general guideline is if a pregnant mare, as she approaches her due date, if she starts to slowly drip a little milk out, maybe we don't intervene at that point. But if she actually starts to run milk, she's losing colostrum at that point on the ground, what we would want to do is strip her out, save that colostrum, and feed that back to the newborn foal after she gives birth. Because that colostrum is high in antibody levels, IgG-type antibodies. Those newborn foals critically need that colostrum for protection against infectious diseases. One of the last signs, visible signs that we'll see prior to birth is elongation of the vulva. The photograph on the left shows a vulva of a mare that's either not pregnant or early in pregnancy, and the one on the right is in the minutes to an hour or so prior to foaling. The vulva will elongate, get a little edematous in preparation for the foal passing through. There's some other ways that we can predict when foaling is going to occur, and one of the more common ones is to evaluate milk calcium levels. In the graph, we can see the upper line shows blood levels of calcium that have to stay relatively stable across time. But milk calcium level, this is calcium that is sequestered from the blood and deposited in the milk. As the mare approaches her foaling time, which is time 0 here, levels of calcium in the milk start to rise dramatically. And the majority of mares will foal out once the calcium level reaches around 200 parts per million or greater. So that this rise in calcium that's right in this zone is very predictive of that mare that's about to give birth. So a couple of the diagnostic tests that can be used to monitor milk calcium. One is called Predictafoal. It's really a dipstick test that has 5 boxes here, all at different calcium set points. And this little strip is dunked into a tube containing a specific dilution of milk and distilled water. And then once that has been wetted with that solution, you wait about 60 seconds and evaluate how many of those boxes turned color. If no box changed from green to pink, or if only one box changed, that would suggest that the calcium level is quite low and that mare is not likely to foal out, at least in the near future. However, if 5 or 4 or 5 boxes change color, it would indicate that calcium levels are high and that mare is due to foal out very soon. Another one is called Foal Watch, and this is actually where we titrate the amount of calcium. And there's a glass chamber here that's aspirating a little milk solution that's got an indicator dye, and when enough of that indicator dye and milk has been aspirated up to turn this blue, then that is a titrated calcium level. If we look at this set of glass vials down at the bottom, the first vial is from a mare that's not imminent closely to foaling, and calcium, it never turned blue, indicating that the calcium level is undetectable. The next day, there was detectable calcium in the milk, and if we could actually read that off, that would be about 65 parts per million. Then every day that went by, the amount of calcium in the milk got higher and higher, and this vial changed blue by adding less and less of the milk solution until it reached about 200, 250 parts per million. And this mare gave birth that night. So very handy to measure milk calcium over a period of sequential days to predict when that mare is actually going to give birth. And here's some data from a number of mares that about a week to 10 days prior to foaling, milk calcium levels low, and then it slowly increases and then more dramatically increased to greater than 200 parts per million, and then the mare gave birth as indicated by the arrow. And one of the other diagnostic tests that's gained popularity in the last year or so has been the measurement of pH, or the acidity in milk. And one can measure that with a pH meter or with pH strips. And there's a number of companies that make these pH strips. If we look at the graph over here on the left, we can see in a test of one mare, milk calcium started to be being low, really undetectable. Finally detected a couple days prior to foaling, went up a little bit, and then jumped to 250 parts per million, and then the mare gave birth, again as indicated by the arrow. And then as we were monitoring pH of the milk, it stayed between 7.5 and 8 on the pH scale, dropped a little bit, and then the night before foaling dropped to below 6.5. And that's been fairly consistent on a majority of mares. But one of the challenges is getting a consistent reading from any of the pH strips, and then the person-to-person variation in interpretation of the color. So right now our collective opinion is that the milk calcium offers a better, more diagnostic way to monitor impending foaling, but pH has good potential for the future. Many people use labor alert devices like Foal Alert to indicate that a mare is actively in labor. For those of you not familiar with this, there's a transmitter that's actually fixed onto the vulva of the mare, so that when the mare actually goes into labor and her vulva opens up, allowing the front feet and then the head of the foal to start to pass through, little magnet is separated from the transmitter, and then the signal is sent from this transmitter to the base station. And that will emit an audible sound, but for many people they actually add an auto dialer along with that, and that can activate your cell phone. And where this is really handy is most people realizing that mares foal at night typically, they're ready for foalings in the middle of the night. They might stay up and watch or have it on video camera that we'll talk about next. But during the day when people aren't necessarily ready for a foaling and have work to do around the farm or ranch, or have a day job, then having this alarm activate saying that your mare is now in labor is really handy. So for daytime foalings and general foaling, we really think the Foal Alert system has great potential for use on many facilities. The last thing I'll talk about before turning it over to Dr. Ferris is video monitors. Many ranches, and including our reproduction facility, we use video monitors to keep an eye on the foaling stalls. And right now we've got a series of these, I call them bubble type monitors, that we can visualize horses in the foaling stalls. People can call them up on the web and look at those while doing other daily activities, or or look at them on your smartphone. So we're going to turn it over to Dr. Ryan Ferris now to talk about the actual labor process.
So the horse, like a lot of our domestic species, the fetus is really the driving force behind when the birthing process is actually going to occur. And really that process occurs by the fetus as it matures in the mare and in the uterus. And once it gets to a point where it's capable of surviving outside of the foal, that fetus is going to signal to the mare that I'm ready to come out, and the birth process really will be initiated at that point. The mare has really almost no control over this entire process. She can delay things a couple hours, but can't significantly delay this overall event. Once the foal has signaled to the mare that it's ready to come out, the birthing process is imminent. So as we start into the birthing process, the first stage is stage 1 of labor. And with this, you may notice that your mare may become restless. You may notice she's frequently lying down, getting up, lying down again, standing, moving around the stall kind of restlessly. She may paw at the ground occasionally. And this can go on for somewhere 1 to 4 hours. And it seems like our maiden mares, our mares that have never given birth to a foal before, that the duration of stage 1 of labor may be a little longer. But for our mares that have had multiple foals, stage 1 of labor oftentimes is quite short, maybe as short as an hour. And during this entire process, what's occurring is there's small amounts of two hormones, oxytocin and prostaglandins, being released, and they're causing mild uterine contractions, and that's to stimulate that foal to go into the normal birthing position. And these two hormones are going to cause some things that we can see externally. One, prostaglandins. You may be familiar with giving prostaglandins to your mare in a breeding program, and may have noticed that your mare may have gotten a little sweaty afterwards after administration of that hormone. Well, during the foaling process, the same thing can occur. We may notice that our mare may start to sweat around the shoulder and neck region. The other thing, from the oxytocin being released to help stimulate the uterine contractions, that hormone can also work on the mammary gland and induce milk letdown. So it's not uncommon to see a mare that may start to actively run or drip just a little bit of milk during the stage 1 of labor. So here we have a video of the actual stage 1 of labor, and this is a view from our barn cameras at the Equine Reproduction Lab. So here's a mare that's she's a little restless. She's pawing there at the ground. You can see she's just sort of moving around, kind of pacing the stall. She'll shift her weight back and forth there between her two hind legs. And you can just sort of tell that overall she's a little uncomfortable as that foal gets into the normal birthing position. Here's a mare that's lying down, rolling just a little bit. And this would all be part of the normal part of stage 1 of labor. Posturing to lie down. So this is a mare that it's a little awkward. This mare is gonna lie down, almost lay down, and then get back up. And really, it's just that fetus repositioning itself, getting into the normal birthing position. Some of the mares will look at their flanks quite frequently. It seems like when I'm doing the full watch and watching those maiden mares, those mares that never give birth, they're really watching their flanks, almost curious as to what exactly is going on in there. Here in Colorado, it can get a little chilly at night, and from that prostaglandins and some of these mares getting sweaty on their neck and shoulder, you can actually see some steam coming off this mare here in the foaling stall as she's looking at her flank. So the end of stage 1 of labor and the start of stage 2 of labor is when the mare breaks her water. So really the act of the mare breaking her water is with the rupture of the chorioallantoic membrane, or the outer membrane. That's the membrane that's attached to the uterus and should stay attached to the uterus until the foals completely come through the birth canal. And so with the start of stage 2 of labor now, with the mare breaking her water, this is going to be the start of active labor, very strong abdominal contractions and uterine contractions, and really the whole birthing process in the horse takes on average about 17 minutes, and so it happens very quickly, and so sometimes it's even hard to get from your house out to the foaling stall to be present as this foal comes through. And as you can see here in the bottom right video, or photo, sorry, here on the right, you can see this mare is breaking her water. Here's a mare on the top here that's standing while she's breaking her water. And the thing we'd like you to recognize is that this is a very fast process, and that if there's a delay in delivery of that foal, it can result in an increased risk of fetal or neonatal death. So as we go through this, after the mare breaks her water, within 30 seconds to a minute, we'll start to see the amnion, or the inner membrane. Now, this is a membrane that's going to cover the foal. It's kind of a bluish-gray membrane. It's kind of translucent, and you can see through it. So shortly, right after the mare breaks her water, oftentimes we can see this amnion starting to come through the vulva of the mare, as you can see here. Followed by that, within a minute or two following the mare breaking her water, oftentimes we start to see a foot. And oftentimes it's one foot starts to come through, and then shortly thereafter a second foot. And the reason for that is the foal literally has to walk its shoulders through the birth canal. And if both feet came out at the same level, the shoulders are a little bit wider and may not fit quite as easily. So by having the front feet just at a slight different length coming through, it just narrows the shoulders up. Typically, by the time we can see the mid-cannon bone of one of the front feet, we can oftentimes see a nose at that point. And really, as the mare continues to have strong abdominal contractions during this, once we get the shoulders through the birth canal, the foal typically just slides right on out. Hip lock that's quite common in cattle really doesn't occur in the horse. We don't really see that as an issue and a common cause of dystocia. So as you can see here, very quickly, once the shoulders pass through, this foal would have just been completely delivered. Here's the normal delivery of a foal. So this mare here is an active stage 2 of labor. She's having strong abdominal contractions, and you can see with each contraction that she continues to have, that foal continues to slide out of the mare just a little bit more. And that's what we want to see, is with every abdominal contraction, there continues to be a progression of the foal coming out of the mare. Oftentimes these foals will be quite still and won't move a lot until the foal actually comes out of the birth canal and that chest expands, in which case normally the foals start to become quite active and moving. You can see the amnion still covering this foal's nose here, and as it continues to slide out, hopefully that'll tear away the movement of the foal. As you can see right here, that foal's out, it's nickering to its mom. It's only a few seconds old, and it's already trying to sit up sternly and talk to its mother. All right, so moving on to the final stage of labor, stage 3, with the passage of the placenta. The placenta is typically passed in 15 minutes to 3 hours, with an average about an hour and a half. We consider the placenta to be abnormally retained after 3 hours, and as Dr. McCue was talking about earlier, starting to develop a plan with your veterinarian would be key. And what I would encourage you to do is to have a discussion with your veterinarian that if you do have a retained placenta, how is that going to be handled? When does your veterinarian want you to call them, and how should it continue to be managed in the future? And now back to Dr. McCue to talk about dystocias.
So the good news is that the vast majority of foalings occur spontaneously, normally, and with no assistance needed. But occasionally a mare will need a little help during a difficult birth process. And the term for that is used in the obstetrics world is dystocia. So that refers to an abnormal or difficult birth, and in the horse world it would also indicate a stage 2 of labor, active labor, that lasts longer than 30 minutes. It's been estimated that a difficult birth occurs in 4 to 8% of all births in the equine world, but many of them, the vast majority of even the difficult births, are only a minor difficulty, and the real severe ones are very uncommon. The maiden mares, first foaling mares, would be the most common of the horses for that. If we look at the differences of what causes the difficult birth and look at it from a maternal cause or a foal cause, uterine inertia can sometimes occur in the mare, and that's when she has been pushing and pushing and is really exerted herself to the point where she cannot push anymore. Or some mares, actually, even from the early stages of labor, just don't push very much. That really is not the more common one. The most common one is failure of the fetus to line itself up in the birth canal. And if they don't get into the classic diving position of both front legs extended and the head and neck extended, they cannot pass out effectively through the birth canal. So some of the key components to how to manage a dystocia and know what to do in the middle of the night is to get some training, hopefully in conjunction with your veterinarian, Try to get some experience with the foaling process, and then be prepared. Have some equipment on hand, and mostly have an emergency plan. What are you going to do at midnight or 1 in the morning if your mare experienced a difficult birth? Who are you going to make that phone call to? Should you put the mare on a trailer and take her to a clinic, or call your veterinarian out, or call somebody else on the farm or ranch out to give you a hand? In most situations, we recommend at least making an early phone call to get assistance. Then when to make that call. So our guidelines are, if there's really no progress toward delivery by 15 to 20 minutes, I start to get nervous after about 10 minutes if there's not the normal progression of signs that Dr. Ferris went over. Mare breaks her water. Within a minute or so, you start seeing the amnion. Within another minute or 2 or 3, you start seeing the first front foot, then the second. The nose of the foal should be in about mid-cannon bone area. That normal progression of events should occur in the first 5 to 10 minutes. And if that doesn't occur, that's a little warning. Another one is if there's been a normal progression toward foaling and then that stops. An example would be a mare that has, you see the amnion, she breaks her water, you see the amnion, one front foot, a second front foot, and nothing else after that. She doesn't continue, or has uterine contractions, but doesn't continue, and you don't see the nose, and the progression towards foaling doesn't occur, possibly because the head of the foal is turned back. Some other ones, if the mare becomes painful or shocky, if you already know there's a problem, like the mare is giving birth, one front foot comes out, the nose comes out, but the second front foot's not there, already you know that one leg is back and that foal will not be able to be delivered. That, again, is a time when you should immediately make a phone call for assistance. And then if you're unsure of what's going on, or just know that you don't have the ability to diagnose or correct the problem, again, call for assistance. That's our main goal. So we do assist with delivery on occasion. With a normal foaling, we don't. But this is an example of a mare that's giving birth. She just got tired of pushing, and all we're going to do, she got the head mostly out, and all we're going to do is apply a little bit of gentle traction to just kind of re-stimulate her. And once we started doing that, she started having uterine contractions again, and help push the foal out. And we did very little for her except offer a little bit of guidance. Normal foal, big foal for that mare. In this situation, this mare was giving birth, and we waited about 15 minutes, and she quit pushing. She's still in active labor, but we're just going to turn the sound down on this. And so we've hooked up obstetrical chains. We expected this mare to actually lie down as we were getting started with this, and she just didn't want to lie down. She's given birth to other foals before, and it's a fairly good-sized foal. We just need a little assistance, and then Dr. Burden here is going to reach in and guide that foal to the ground. So the majority of mares, this foal's alive, healthy, and just needed a little help getting out, and the mare had kind of stopped pushing on that, and everything ended up being fine with that foal delivered normally, but with the mare standing. I'm going to go on to the next slide here. One other issue is premature placental separation. In the horse world, it's often called red bag. The photograph on the right shows the intact outer placental membrane called the chorioallantois. That should have already ruptured. When a mare breaks her water, this membrane spontaneously ruptures. The break period, the break area is right in through there at it's what's called the cervical star. So when a mare breaks her water, it should rupture here. Allantoic fluid should rush out. This mare, instead of having her outer placental membrane rupture, it stayed intact, and then the whole unit is being disconnected from her uterus and sliding out again intact with that foal still inside of it. The foal in this situation is at high risk of losing its oxygen supply. So when one sees this brick red looking membrane with this prominent white area, which is a normal cervical star, protruding through the vulva, it's an emergency situation. And the foaling attendant, whether that's the owner, a foaling monitor, whoever that person is, barn manager, that person should open up that membrane. You will be breaking her water, and then assist with delivery of that foal. That foal needs to get out and get oxygenated, whether that's from room air, or if you've got the potential to have available near the foaling stall, that would be advantageous. But we're going to go back to the guidelines for newborn foals and what to do for routine care of the newborn foal.
So for the vast majority of our foals, and we're just in a few minutes following the foaling process here, is kind of what to expect next. And there's always been the rule that was used as the 1, 2, 3 rule for newborn foals, and that the foal should stand by 1 hour, nurse by 2 hours, and pass meconium hopefully by 3 hours. And we looked back over just over 1,000 different foalings and found that, yes, that's actually what happens. The average foal stands at about 58 minutes. Takes just a little over 2 hours for the vast majority of foals to nurse, and takes just short of 90 minutes or an hour and a half for the foal to pass meconium. And interestingly, what we found is that if the foals followed those rules, most of the time everything worked out just fine. But if it took longer for them to stand, to nurse, or to pass meconium, those foals are at an increased risk of developing an infectious disease in the first week of life. So as we're here just a few minutes following foaling, the foal hasn't even stood up yet. One of the things we're going to want to do is evaluate the colostrum quality. And the reason for that is the mare over the last few days has pulled antibodies from her blood and concentrated them into her colostrum. And she's going to pass those antibodies on to her foal. Most foals are born with very few circulating antibodies of their own, and these foals depend on receiving these antibodies from the mare in the form of colostrum to prevent infectious disease for the first 3 to 4 months of life. So to make sure that foals are getting exposed to good quality colostrum, we evaluate that using an equine colostrum refractometer. We would just collect a couple drops of colostrum from the mare, drip it onto the prism of the refractometer, close the lid, and then could actually just look through the eyepiece and evaluate how good the colostrum is. And here, as you can see on this right-hand image, the blue coming down from, you look at the interface of the blue coming down from the top and the white from the bottom. So for this particular mare, she has a colostrum quality of about 21%, which is of good quality. So this would be the type of quality colostrum that we'd like to have all of our foals receive. The reason why it's important to perform this evaluation is it allows us to predict the success of antibodies being transferred from the mare to that foal during nursing. And essentially at this point here, what we can do is go, well, we already know that the mare has poor quality colostrum, so that allows us to supplement early, potentially from our frozen colostrum bank that we'll talk about here in just a few minutes, to give that foal some high quality colostrum and help hopefully prevent some infectious diseases during the first few months of life. The alternative is this mare could have outstanding colostrum quality, and in which case she'd be a good candidate for a small donation to our colostrum bank. So to develop a colostrum bank, we would encourage almost all owners to create a colostrum bank if they can, evaluate the quality of the colostrum. Hopefully it's of good quality. You should only really save colostrum if it is of good quality. Collect a small amount, about 8 ounces. We strain it through a piece of gauze or cheesecloth, as you can see here, and that's to remove any debris, shavings, straw that may have gotten into the milking container. Pour it into a labeled plastic bottle. And we found that using a plastic bottle is really helpful. If you just put it into a freezer bag and place it in your freezer, that freezer bag will stick to other things in your freezer, and then when you go to pull it out when you actually need it, a small hole may develop in that freezer bag, in which case then that colostrum could leak out as it thaws. Able to be stored in your freezer for 1 to 2 years, and it's really the classic Robin Hood story here. You're stealing from the rich to give to the poor. So you take a little bit of colostrum from those mares that have outstanding quality colostrum and give to the foals that their mare just had poor quality colostrum that year. Again, here, just in the first few minutes of life, we try to treat the umbilical stump. And infectious organisms, specifically E. coli, have access into the foal through that open umbilical stump. And so we try to repeatedly apply an antiseptic agent to help reduce the incidence of umbilical infections. This antiseptic agent that we most commonly use is a chlorhexidine solution, typically diluted 1 part chlorhexidine solution to 1 part sterile saline. And this would be the chlorhexidine solution that you can purchase at most veterinary supply stores. We try to do this 2 to 3 times per day for the first 2 to 3 days of life, and we found that these 50 ml conical tubes work really well. The umbilical stump fits right inside the opening, and you can just immerse that stump with this antiseptic agent. As we move in, as we talked about, meconium should be passed, and it's really the first feces of the foal, should be passed about, on average, about 90 minutes after the foal is born. But there are some foals that are not going to pass meconium spontaneously, or actually may develop a meconium impaction, and they're going to be painful. They may strain to defecate. You can see this foal in this top photo. His back's humped up, his tail's raised, and he's straining to defecate, but is unfortunately unable to. Quite easy to manage or treat. You can get a phosphate enema, a sodium phosphate enema from your local pharmacy, Walgreens, etc. Take that enema, insert it into the rectum, and then you just squeeze the bottle, inserting that fluid up into the rectum, and then really just get out of the way at that point. Normally, most foals, meconium comes just sliding right back out at you following administration of that enema. And finally, one of the last things we want to do is just make sure that that good quality colostrum, that the foal we know was nursing, the mare had good quality colostrum, but then the last thing is, did that good quality colostrum actually get absorbed? The foal's GI tract is capable of absorbing the antibodies in the colostrum for about 24 hours, for the first 24 hours of life. And so we can take a small blood sample from the mare, a small blood sample from the foal, and actually evaluate it for the total amount of antibodies that have been absorbed from the mare. The two tests that we use most commonly are the SNAP test by IDEXX or the ARS IgG test made by Animal Reproduction Systems. And there's a couple times where there's a when to test becomes a fairly critical window. For the vast majority of clinics out there, we're going to test at somewhere 24 to 36 hours of age. We'll take a small blood sample and we'll evaluate if that foal is able to adequately absorb enough antibodies to protect it from infectious disease for the first 3 to 4 months of life. The downside to measuring at this time point is that GI tract, again, is completely closed and no longer can absorb oral antibodies. So if this foal did not receive enough antibodies or did not absorb enough antibodies in that 24-hour period, it now needs to receive an IV plasma transfusion. We've started in our clinical program for the last 6 to 8 years, starting to test these foals at around 12 hours. Now, we recognize at 12 hours that complete absorption hasn't occurred, but it allows us to take a sneak peek into if that foal is actually absorbing enough antibodies. And if that foal hasn't received enough antibodies into its blood yet, it allows us to provide oral supplementation from our frozen colostrum bank at that time. So that may be something that you want to consider adding to your clinical program. The interpretation of these tests, we'd like all of our foals to be greater than 800, and the vast majority of our foals in our clinical program are going to be 1,200 to 2,000 plus milligrams per deciliter of antibody in their blood. And that's really going to help protect these foals from infectious disease, again, for that first few months of life. Foals less than 400 milligrams per deciliter have failure of passive transfer, and those foals really need to receive some form of supplementation. If you're testing early at 12 hours post-birth, that could be in the form of frozen colostrum. If your foal's 24 hours or greater of age when you test, at that point there, we'd recommend that your foal receive a plasma transfusion to get its IgG concentration above 800 milligrams per deciliter. Dr. McCue, back to you for evaluating the placenta.
We're going to finish this by making a recommendation that all people, when you foal out a mare, take at least a quick peek at the placenta. And you're doing this for two reasons. One is to make sure the placenta came out fully, came out intact, and also to look for evidence of placentitis. And if there is an infection in the placenta, it might mean that that foal in utero already had a bacterial infection, and then after it's out, may need to receive some medical treatment for that. So what we'd like you to do is spread the placenta out on the ground. Now, a majority of mares, when they pass their placenta, it's passed inside out, and that's what it would look like in this lower right-hand corner picture. A little bit of a slight purplish hue to the inside lining of that outer placental membrane, and prominent blood vessels visible here. We've got an amnion, umbilical cord, and that chorioallantois. Here it's inside out. If we turn this right side out, the view that we would look at, which is the one we really need, is this view of a reddish maroon color that's velvety due to all the microcotyledons on the outside of this, this placenta. The three areas that we want owners to look for: number one, are both horn tips present? Sometimes a mare will tear off a piece of uterine horn, and it'll almost always be the tip of the non-pregnant horn or the entire non-pregnant horn. Virtually never will only a part of the pregnant horn be left in the mare. It'll be this horn area. So number one, look for the horn tips. Number two, look for the area around where the mare broke her water and passed where the foal passed out, the area around the cervical star. And we're looking for an increase in thickening, or we're looking for debris, inflammatory debris or infectious material that may be around this area, suggesting an ascending placentitis. This lower photograph shows the cervical star area of a normal placenta. The next photograph is an example of a mare that retained part of her placenta. When this mare foaled out, the foaling went normal, everything was fine. The placenta fell out on the ground like it always does, and we spread it out on the ground and saw, okay, we've got an amnion here, we've got the umbilical cord going up and attaching to the outer placental membrane, but we only have one horn of the placenta here, and it's the pregnant horn. And we were missing, and this was the area that we could see that there was a tear in, we were missing the entire non-pregnant horn. This part was still up in the mare. And a retained placenta, whether it's the entire placenta or just part of a uterine horn, is potentially life-threatening to that mare. There can be an overgrowth of bacteria, and the toxins made by the bacteria can cause the mare to develop laminitis or founder. So a retained placenta is a serious thing for that horse, for the mare. So in summary, to have a successful foaling season, we want people to be educated. We want people to know what they're doing to make good early decisions in the event of a difficult birth. We'd like optimal communication between horse owners and their veterinarian to develop a plan, what to do in the event of a dystocia, what to do in the event of a retained placenta, and what to do in case there's issues with that newborn foal. And then finally, to have a foaling kit prepared, to have supplies on hand in case they're needed. So with that, we'd like to thank you for following this presentation brought to you by the Equine Reproduction Laboratory at Colorado State University. You can reach the Equine Reproduction Lab specifically at our email address, erl@colostate.edu, or visit us on our webpage. And with that, we're going to open it up for questions. I know we've got some that have been written in already and sent to us. And I'm going to start by answering one question already. And the first question is, what do we do if one of our mares is painful after giving birth? Well, there are a number of mares that exhibit pain. The majority of mares that have had foals before will give birth and show no apparent discomfort during the birth process. After birth, they immediately turn around and interact with their newborn foal. But we do have some mares that show signs of discomfort. They may paw at the ground a little bit, may lay down, may roll a little. And in those particular mares, we often give them a single dose of Banamine, flunixin meglumine, and that's typically able to block that discomfort. And what we think in the majority of cases, it's still continued uterine contractions in the postpartum period, either while their placenta is still in or even after the placenta is passed. So to answer that question, we don't give it to all mares. I'd probably say less than 25% of mares, but we don't hesitate to give a dose of Banamine to mares if they exhibit discomfort after foaling, because we'd like them to interact with their foal and develop that maternal foal bond. And then I'll answer one more question that's come in. If I had a choice between picking milk calcium and pH testing to predict foaling, which would we choose? And I probably didn't make that extremely clear, but right now we do both, milk calcium testing and pH testing. And it's our impression right now that the milk calcium is a little more accurate and a little more predictive than pH testing. And one other advantage, you get about 2 or 3 days notice that milk calcium is on the rise before the mare gives birth. With pH, often that change is in the last 12 to 24 hours and not giving you really much of a warning sign. Dr. Ferris, do you have any questions that have come in to you?
I do. We just had a recent question of, can we buy horse colostrum commercially? And unfortunately, no, there's not really a commercial source for equine colostrum. There are a couple substitutes of equine colostrum. One of them would be called Ceramune. If you don't have a colostrum bank, you can potentially use this commercial product. It's concentrated equine antibodies in serum form that you can give orally. One other comment with that is people always ask, can we give other species colostrum to the horse? So like cows. Cows have several gallons of colostrum. Can I give my cow's colostrum to my foals? And unfortunately, the diseases that cause problems in calves are not the same diseases that we get in our foals. So those antibodies that will be coming from the cow colostrum just are not effective in preventing infectious disease.
I've got another question over here, and it's last year we had a mare that gave birth and did not let her newborn foal nurse. What should we do? We see the odd mare every year that has at least some level of what we would call foal rejection, and that may be just a mare, and it's often a younger mare, a maiden mare, that this is their first foaling experience, and they may resent, not resent's not the right word, but they may not really want to have that foal nurse. It's their first time having a foal. They may not be sure of what's going on. They may not let their foal nurse. Some individual mares will actively move away from their foals, and in rare circumstances have been known to actually bite at or kick at their foals. So what we generally try to do when that happens is gently restrain the mare. We may offer the mare a bucket of grain. We may look at other aspects of, is she uncomfortable, and if she is, she may get a dose of Banamine, but more commonly, light restraint on the mare, literally just holding onto a halter, offering her grain as a distraction, and then allowing that foal an opportunity to safely get to the udder of the mare and start to nurse. And by and large, if we can do that, distract the mare enough to allow that foal an opportunity to nurse, you can watch the maternal instincts kick in over time on that mare, and then she'll settle in. Sometimes there's a little more restraint needed. Once in a while, we might sedate a mare, but generally, just a little bit of light restraint is enough. We've got another question that came in, and that's who's going to win the Super Bowl this year, and we'll leave that question open. I've got another one that some people say it's important to keep pregnant mares under lights, and why would we do that? And the keeping pregnant mares under lights, that's generally talked about for mares that are going to foal out early in the winter season. That would be mares that are going to foal out in January, February, and maybe into March. There are mares that will foal out in that early part of the foaling season and not cycle back real well. And that's usually a photoperiod dependent issue. And if we keep those pregnant mares under lights, they're more likely to give birth normally and then continue to cycle, have a foal heat, actually ovulate, and continue to cycle afterwards. So again, the reason for putting pregnant mares under lights is usually the mares are going to foal early in winter, and it's really to try to get them to cycle and keep them cycling after they give birth. Again, Dr. Ferris, do you have other questions?
Yeah, we just had a question come in of our mare last year foaled out at around 368 days. Should we have induced our mare into labor at 340 days? And this is a common question we get, especially with the average mare foaling 340 days following ovulation. We expect that, probably 80–90% of mares are going to follow those rules and foal out around 340 days. But there's the odd mare that goes long in gestation. And we get several phone calls a year asking, boy, should I induce this mare into labor, or what can I do to speed things up? And our typical comment is just relax, just calm down. We understand that, boy, we'd all like to see this cute little foal, but typically that foal in utero isn't ready to be born yet and just needs a little more time to mature, a little more time to cook, if you will, and hopefully, and typically when these mares that go long in labor finally do deliver a live foal, that foal oftentimes is a little smaller than average, which leads us to the decision that we made the right choice. If we would have induced that mare into labor 3 weeks before, we probably would have had an immature foal that may not have survived outside of the uterus. So again, if your mare is going over 340 days, just relax, and when she is ready, she will give birth.
Got another question here from Grand Junction, Colorado. Do we recommend breeding a mare back on her foal heat? And that's really an owner decision. And our guidelines to owners are this: if the mare had a normal foaling, as in no dystocia, she had no retained placenta, and there was not any prolonged discharge of that normal fluid coming out of her uterus called lochia, if there was no prolonged discharge, that discharge should be gone by 2 or 3 days post-foaling. The mare should not have any more discharge. If all those things are good and normal, then we would consider breeding on the foal heat. And in an ideal situation, the average mare, by the way, ovulates on day 10 or 11 following birth. Pregnancy rates are high and good if the mare holds on to that follicle for at least 10 or 11 days. And if she ovulates earlier than that, if she ovulates on day 9 or day 8 or day 7 after birth, pregnancy rates are not high. So our goal is to optimize pregnancy rates. So if the mare has a normal foaling and no retained placenta, and she holds on to her follicle for at least past 9 days, then breeding on the foal heat's a reasonable decision. On the other hand, if the mare ovulates early, you can then choose to breed on the next natural heat, which would be the 30-day heat, or one could short cycle the mare, allow the mare to ovulate, administer prostaglandins 5 or 6 days after ovulation, and breed her back on the short cycled heat. So our guidelines are based on what the owner wants to do, and we certainly support people that do want to breed on their full heat if they follow those guidelines.
Dr. McCue just had a question come in here. Last year my mare leaked milk for 2 days prior to foaling. Is there anything I can do to get ready for this year's foaling? And the real key to that mare leaking milk for 2 days prior to foaling out is the fact that she just lost her valuable colostrum. So that colostrum that's rich in antibodies has leaked onto the ground last year and would be wasted. So if you're leading up to the foaling event this year and your mare starts to leak milk again, or colostrum more importantly, this year, I would encourage you to milk out that mare. Collect that colostrum. You can evaluate it with a refractometer. And all of the good colostrum, go ahead and save it. So that way when that foal's born, you can provide that supplementation back to that foal and allow that foal to have access to good quality colostrum.
I think with that, we haven't gotten any more questions that we can see right at this moment. I would encourage people, if you do have other questions, send them in by email, and we'll try to answer as many of them as possible. So with this, we would like to thank you again for attending this session of Google Hangout, brought to you by Colorado State University on foaling and foal care. And with that, we're going to sign off, and thank you very much.